Hello, this is your University of Minnesota care team. This is a discharge instruction video for patients recovering from holmium laser enucleation of the prostate, or HoLEP. In this video, we'll guide you through what to expect after your procedure and how to care for yourself at home. After your HoLEP procedure, it's important to take it easy while you recover. Here's what you need to know. You can restart light activities such as walking, climbing stairs, and driving as soon as you feel ready. Wait 2 weeks before doing aerobic activities like running or swimming. Avoid straddle activities such as biking, lawn mowing, or riding a motorcycle or snowmobile for 2 weeks. Avoid heavy lifting greater than 15 pounds for 4 weeks. We recommend waiting 4 weeks before resuming sexual activity. You can safely restart when your urine looks clear. After HoLEP, you may notice a change during sexual activity. It's common not to see fluid expelled from the penis during orgasm. This is called a dry orgasm and is a normal result of the procedure. Your body still produces seminal fluid, but it's pushed into your bladder rather than exiting through your penis. You will pass this fluid next time you urinate. It's normal to experience certain symptoms as your body heals. Here are some of the most common. You may have some leakage of urine. This typically improves within 6 weeks, but can take up to 3 months. If it persists, talk to us about a referral to a pelvic floor physical therapist. Burning with urination. This is common, especially in the first few days after surgery, because of the surgical scope and catheter removal. It should improve with time. Over-the-counter pain medications such as azo or pyridium and staying hydrated can help. However, you may want to check with your doctor before taking any of these over-the-counter medications. You may also feel a strong urge to urinate, which also gets better with time. Seeing pink or red-tinged urine, flecks, tissue, or small amounts of blood or blood clots in your urine is normal for up to 4 weeks after surgery. You might notice more blood after physical activity. If this happens, reduce your activity and increase your fluid intake to 2 to 3 liters a day. However, occasionally, some patients experience more significant amounts of blood in their urine. Blood in the urine, which we call hematuria, is generally okay if it looks like grade 1, 2, or 3. You can increase your fluid intake and continue to urinate normally. However, if your urine looks like grades 4, 5, you have large blood clots, or you're unable to urinate, contact our clinic or go to the emergency department. Some patients may go home with a catheter. Here are tips to care for it. Empty the drainage bag several times a day. Secure the catheter to your thigh with a securement device to prevent tugging. You can shower normally. Let soapy water rinse over the catheter. Gently clean any buildup at the insertion site with a towelette or washcloth. Use Vaseline at the tip of the penis to prevent chafing. What to expect with the catheter. Urine leakage around the catheter is a common finding in patients with a catheter and is usually no cause for alarm. Typically, it is due to bladder spasms. Bladder spasms occur because your bladder is not used to a foreign object and tries to squeeze it out, releasing urine around the catheter. Sometimes patients experience abdominal cramping. Typically, bladder spasms resolve after a few days. Feeling the urge to urinate. Some patients feel a persistent need to urinate with the catheter in place. As long as the catheter is still draining, this is likely due to that foreign object sensation in your bladder. Even though your bladder is empty of urine, the catheter balloon gives a false sensation that your bladder is full. This typically subsides after 24 to 48 hours, but there are medications that may be able to help with this if the feeling is too bothersome. Bladder spasms may also cause a temporary stoppage of drainage from the catheter. This typically resolves within 30 minutes, and you should see urine within the drainage tube again. If urine flow does not resume, your catheter may be blocked, and you should reach out to the urology clinic or go to the emergency room. You may notice that your catheter slides in and out. There is a balloon filled with water inside your bladder to prevent the catheter from slipping out. The tubing is quite long and may slide back and forth freely. If the catheter does slide out completely, keep the catheter and call your care team immediately. Obstruction can feel like pain at the tip of the penis or a gradual sensation of fullness, distension, bloating, or increasing pain in the suprapubic area. If this is the case, or if you notice no drainage from your catheter for greater than 30 minutes, contact the urology triage line or go to the emergency room for further evaluation. If you're discharged with a catheter, you should have a follow-up appointment within 1 week to have it removed. At this visit, we'll check if you can urinate on your own. If not, the catheter may need to be replaced. If you are not discharged with a catheter, you should have an appointment in the urology clinic with your surgeon in about 6 weeks to check on how you're doing. A scheduler will call you the week following your surgery to make this appointment. In most cases, you can stop your prostate medications after surgery unless otherwise directed. For blood thinners, follow the specific instructions in your discharge paperwork. Contact us or go to the emergency room if you have chills or fever over 101.4, you're constipated despite taking Miralax twice daily for 2 days, you see concerning amounts of blood in your urine, you're unable to urinate. Thank you for watching. We hope this video has answered your questions and prepared you for a smooth recovery. If you have additional concerns, don't hesitate to contact our clinic. Take care, and best wishes for your recovery.